Okay, next on our parade through the Enterobacteriaceae, we're going to talk about Proteus. Proteus is a highly motile organism because it has what we call peritrichous flagella, which means that if this is the bacteria, completely surrounding the bacteria are flagella. So it can swim anywhere it wants to go. All right? That also aids its ability to move up the urethra and gain entry into the bladder. This is a non-lactose fermenter, but the next thing I'm going to tell you as far as virulence is probably one of the things you really have to know. It is also urease positive. Urease positive. We talked about one other organism so far that was urease positive, and that was Helicobacter. Proteus is also urease positive, okay? And just like the urease helped Helicobacter actually live and survive and grow in the stomach, Proteus, by having this urease, kind of sets it apart from some of the enterics that cause UTIs, because the urease can actually cause and lead to the formation of kidney stones. Now, the species we're going to talk about are Proteus mirabilis and vulgaris, where mirabilis is really responsible for the majority of infections. But if you see either one of those, they basically cause a very similar disease. So we talked about the fact that it's highly motile. I have mentioned the word swarming when we were talking about the flagella early on. But if you had a petri dish and you had a liquid culture of Proteus and you put a drop in the middle of that plate, normally with any of the other organisms you would see a nice little colony form where you put the drop. With Proteus, it's like, not staying there, and swarms across the entire plate. So by the next day, can't really find one colony, but the organisms have really moved across that entire plate. Urease is extremely important. We'll talk about that. And again, as far as the family characteristics, it's facultative anaerobic and oxidase negative. So you would be able to differentiate it from, let's say, Pseudomonas based on the oxidase test, because these are lactose non-fermenters. However, remember, all members of this genus and family can ferment glucose, so it is a fermenter. Now, the reservoir is the colon. It can also be found environmental, but most of the time we're talking about an endogenous transmission from normal flora. Now, I mentioned urease was important. Urease raises the pH, okay? It raises the urine pH and causes the formation of kidney stones, or more specifically, staghorn renal calculi. So now you are reading your exam and you've got somebody, you've got maybe a young female that's presenting, again, with the symptoms we've talked about several times now for UTIs. You've got burning, frequency, urgency. But now they mention lower back pain. You've got this flank pain and you've got a fever, right? That's indicative of possibly kidney stones. And so in that vignette, you've got to start thinking about Proteus because of the lower flank pain and the possibility of having kidney stones. Now, the extreme motility we mentioned earlier helps the organisms swim up into the bladder. And as always, with the gram-negatives, the endotoxin can cause shock. So the diseases are UTIs with the possibility of stone formation and gram-negative sepsis, as we talked about for E. coli and Klebsiella. When we diagnose this, we can diagnose it on McConkey. Again, you can put it on normal TSA auger and look for the swarming motility. We're going to treat it with fluoroquinolones or trimethoprim sulfamethoxazole. And clearly, if there's kidney stones, that's going to usually require removal. Now, Proteus is also associated with catheters. So again, as far as prevention, the only thing we can really do is leave those catheters in as short of a time as possible to keep that flow of urine from flushing those organisms out of the urethra.